This is Sarah with Mom's Mental Health Initiative, and we are doing an IG Live today from Lakeside Natural Medicine in Shorewood on Oakland Avenue. It's just beautiful outside, and we're very grateful. Today we wanted to meet and talk with Dr. Aponte, right? Who is one of the doctors here at Lakeside Natural Medicine. And we want to talk about, how perinatal mood and anxiety disorders can be affected by our physiology. What's going on with our bodies when we're pregnant, have a baby, and postpartum, especially what's going on that can influence us to operate from like a level of more depletion and how that's affecting our moods and our anxiety. So why don't you tell me more about you? And this is my first Instagram Live interview, so just beware. Let you all know.
And my first Instagram Live interview as well. So
tell me more about you and who you are and what you do.
Yeah, hi, I'm Dr. Aponte, and I'm one of the doctors at Lakeside Natural Medicine. As a naturopathic doctor, we have similar training to primary care doctors and general practitioners, but then we focus on natural therapies and diet and lifestyle. And in my practice, I focus on digestive disorders and women's health and hormone imbalances and fertility. And one of my favorite things to do is to help women get pregnant, but also have healthy babies and feel well during their pregnancies and afterwards, because it's hard having a baby and it's hard being a mom. So
yes, that's an understatement. So when somebody's going through that pregnancy and postpartum period, can you tell us a little bit more about what physical changes might be happening that could maybe lend itself to anxiety and depression?
Yeah. So before, throughout pregnancy, hormone levels are rising, rapidly rising, and they continue to rise until you give birth. So estrogen is rising, progesterone, cortisol, and testosterone. And estrogen really starts to rise before giving birth, because you're getting ready to nurse your baby and you have to build your milk ducts. So right after you have your baby, all of that crashes. It falls drastically within hours. So there's a big, fast crash. And estrogen, testosterone, cortisol, and progesterone are all very low. And so with that, our hormones affect our neurotransmitters, our brain chemicals, like GABA, which is our calming neurochemical, and serotonin, which is our happy neurochemical. So when your estrogen and progesterone are low, so are those neurochemicals. So you can feel more anxious and you can feel more down and low and depressed because your hormones are low and your neurochemicals are low. They do start to bounce back, but that takes time. And when you're a new mother and not sleeping, and maybe this is your first baby and you're not quite sure what to do, or maybe your infant is having a little trouble with some things and it's causing some stress, it makes it harder to bounce back. It makes it harder for the ovaries to bounce back to get those estrogen and progesterone and testosterone levels back up. And that can leave you feeling pretty down and depleted for a while.
I always tell some moms, some of us are blessed with the vulnerability to anxiety and depression. We just might have that vulnerability based on biology, environmental situations, things that have caused us to be easily triggered sometimes. And some of us, when those hormone levels drop, are really triggered because of our vulnerabilities. And I know when I had my son, as soon as he came out, and I was like, put him back. I don't know how I feel about this. I ended up having, in the hospital, some intrusive thoughts and panic attacks. And but I have a history. I'm genetically loaded for anxiety and depression. And for others, things might play out later on down the road. So if you can talk a little bit more about what changes are going on in that postpartum period, when do things start leveling out? When might be another big change that's happening in the postpartum period?
Yeah, I think every woman will be different of when hormone levels will bounce back. It can happen within, a couple months, right? But we see like a lot of women, it's not happening as quickly as we hope or thoroughly enough. And I think in my patients, I see that, potentially ongoing throughout, for months because of some of the depletion. And so, using some tools to nudge things, different herbs, nutrients can be really helpful.
Okay. Yeah. So, can you talk a little bit more about what symptoms we might experience if we're needing a nudge?
Yeah,
I guess you could say.
If there is some postpartum anxiety and depression, or just depletion after you have your babies.
Yeah, absolutely.
And when I say depletion, that's potentially of your adrenal glands, which make your stress hormones. Okay. Depletion of your ovaries, maybe not making enough estrogen, progesterone, testosterone. Then there's the thyroid. Your thyroid might be sluggish, so that's another area of depletion. And then we have nutrient depletions too. So iron being a biggie, right, because you lose blood. Zinc, vitamin D, and the B vitamins like B12 and folate. Those are all like the common depletions for women. So some of the symptoms that you might experience would be, this very strong fatigue that doesn't relent, and it can either fluctuate throughout the day, which might be more your adrenals, or if it's consistently low, it might be more like a nutrient deficiency or thyroid. More trouble sleeping. Right, even when your baby's sleeping and then you can't fall asleep, that's a problem. So,
yes.
Hair loss, although common initially, it's normal to lose hair in the few months postpartum. If it's excessive or it persists, then that could be a nutrient deficiency, iron and zinc, and thyroid. It could be multiple things, right, leading to a lot of these symptoms. Of course, the mood issues, a lot of irritability, low stress tolerance, feeling overwhelmed, worrying more, not being able to calm your thoughts, those kind of things too. And then other hormone imbalance symptoms like acne, right? Some women's acne flares up during pregnancy or after pregnancy, or based on different hormone imbalances that pop up. And then once maybe your period starts to come back, there'll be really bad PMS or irregular cycles, just unusual things about your cycle that are not your normal.
I've seen a lot of our participants end up developing PMDD, premenstrual dysphoric disorder, right? After they've had PPD. All of a sudden these symptoms during their period really ramp up. I mean, some have very intense symptoms like intrusive thoughts around their period.
Right, it can be very drastic with PMDD. Yeah, and that's because of the hormone imbalances. Usually the estrogen is high relative to progesterone. We need to balance that out. The other thing that happens too is for some women, they're just very sensitive to the hormone shifts and changes. So women in the perinatal period or postnatal period, right, with that rapid drop in estrogen and hormones, they feel that in their mind, and their neurochemicals and brain respond so much more. Same things can happen with someone with PMS or PMDD. They're just ultra sensitive to hormone shifts. So what we do about that is just make sure that they're very well supported with all the right nutrients that help them build their neurochemicals. Because women who are prone to depression, or people who are prone to depression, have been shown to require higher doses or higher amounts of B12. Like the brain requires higher amounts of B12. So we need to optimize that.
Interesting. So I don't know how to ask this, but so at Mom's Mental Health Initiative, we firmly believe in evidence-based treatment. We believe in getting the right help when you're going through postpartum depression or anxiety. However, we also believe there are multiple tools to help support you into recovery and health. And the other thing is that these hormonal and physiological changes are not uncommon to anyone. We are all going through some sort of, when we have a baby, right? And even if we didn't birth our baby, we're still having hormonal shifts and dealing with different, levels like oxytocin and bonding and things like that. I mean, I don't know medically how that works, but I just mean women who adopted a baby can have postpartum depression and anxiety. So it's like there's so many different factors that can play a role into it. The things that we look at is like, how is it affecting your ability to function, and how is it impacting your daily life? And so I want everyone out there to know that there is a spectrum, and that the spectrum of your symptoms can range from mild to intense. And so sometimes it might require more treatment options up front, like medication and therapy, and then moving into some of the hormonal and dietary and wellness needs. And sometimes it doesn't need that, and we can move more into looking at our depletions. I think they all play a role. I think it's like working with your practitioner to figure out timing and how we do. Like somebody who's experiencing psychosis right then, like we can't really wait, right? We need to address it right now, and then get to a place of stability so that you can start working through these things. And I think I'm just wondering if you could speak to that, about how every individual is different and how we use integrative medicine, like working all together and making sure somebody achieves wellness.
Right. And like you said, it's going to be very case by case and individualized depending on that woman's specific scenario and intensity of symptoms. As the natural therapies will be supportive and complementary, but they won't necessarily replace.
Oh, okay.
It depends. If the postpartum anxiety and depression is on the milder side or maybe moderate, and the woman feels like that she can function and she is managing, that is a good time to start with natural therapies. We can make sure that self-care is in place, that the right diet is in place, and things like adequate protein, that sleep is being prioritized, and then using different nutrients and natural supplements to support things. But if someone is not functioning, can barely take care of their baby and is miserable, that's the time to start with medication, whatever's needed, right, that can help. And then we can also use the natural therapies to support that medication to help it work better. Like a lot of the medications, they keep your neurochemicals available in the synapses, or help those neurochemicals react to the receptors better, but they don't help you build those neurochemicals. So that's where we use some natural therapies to use building blocks to build neurochemicals, nutrients to make sure that they're being built.
Yes, and I appreciate you going into that, because I think sometimes people think it's an either or as far as treating and helping women recover, and I don't believe it is.
Yeah, not necessarily. No.
And I think like the other piece is that just the philosophy of integrative medicine, if you could, and natural medicine, if you could kind of go into that more, because I am a patient here. I've been here for quite a while, and it had nothing to do with my postpartum depression or anxiety. It had nothing to do with my moods. It had to do with a stomach issue that I had after a stomach flu. And the first time I came in for an appointment, I said to Dr. Axtell, who works here, I said, I'm not going to change my medication. I'm not going to adjust it. I already had a medical doctor suggest that I reduce it for my stomach, and that did not go so well. And she's like, I will not ask you to do that. No, it's fine. And so we worked on plans to build my stomach back up and help things on top of what I was already taking. And so I really would love to hear more about explaining the philosophy behind integrative medicine, just in general, not just in the postpartum period.
Yeah, I mean, like especially as naturopathic doctors, we're trying to support the body's better functioning, and so what that is, we're trying to see like what is it that you need. What's missing for your body that you need. Are you missing certain nutrients, or diet's not quite there, is like a sleep schedule not there? What in your lifestyle, self-care, and diet are missing? And then we'll work to add those in. And then we want to see, well, what do we need to remove, and what's stressing the body? Where do we have to help it? So I try to think like that, and I learned that from Aviva Roan. That was her way of like looking at things, and I find that really helpful. So as an integrative practitioner, we don't need to replace medications. I mean, medications help people, because as much as we want to address the underlying causes of things, but that's not always easy to do, nor can we. If it's genetics, if it's environmental, we can't always fix that. And medications, like for anxiety and depression, can really work. They really help people. Yeah. So while you're taking your medication, which is helping you, we would look at what is it that we need to give your body to help it function better, and is there anything we need to remove that's getting in the way of healing or inhibiting things. And that's not always going to be a dietary factor or a supplement. That might be something in your life that needs to be changed.
Or a person, right?
Or a person.
Yeah,
or
remove out.
The reasons why we get sick or struggle with our health can be many, and they're not always physical things.
Well, and just the stress and how much stress alters your body. And I think about like genetic stress, like stress that's been passed down through generations, and like racism and things like that. It totally, like epigenetics, it alters the way your body's expressing itself, your DNA, because stress takes a toll on your physical well-being. So okay, so like
that answered your question.
You did. I'm just not an interviewer. I rather talks, if you can tell, and so I'm trying to make sure I'm clear.
I appreciate you talking and sharing this information too.
I'm clear. Right. But there's something that you talked about with sleep and sleep hygiene, and then you're talking about depletions. Can we kind of focus a little bit on feeding our babies? So breastfeeding, chest feeding, some of us, I couldn't breastfeed. I tried. I could not produce, and tried so many ways, and probably a lot of it had to do with my anxiety or depression. Who knows? But I feel like how we're feeding our baby and how we're taking care of ourselves around that can impact our physical body. And so I don't, and they're like, I can't sleep because I have to breastfeed, and I don't know if you have anything to kind of share about that, like how important taking care of ourselves are in that period of time.
Without sacrificing feeding your baby?
Yes. Or all of your sleep.
It gets a little tricky.
Right.
I mean, we do the best we can. And so the issue, what I'm hearing you say, I think, is that like it can be challenging because you're trying to nurse your baby, and if it's not going very well, it can really interfere with your ability to take care of yourself, right? Is that kind of what you're...
Yeah, I mean, like just talking about like all of these things that we put before ourselves, which we have to put. I mean, we have to feed our baby, we have to get up with our baby, but it's like a mindset that we need to alter, and when it comes to having a baby, and like, because it's this martyrdom, it's like we sacrifice everything to ensure everything's just right. And I'm not saying don't feed your baby, but like just how important it is that we're well too in all of that.
I think one of the most important things is to be okay with things just being good enough. Like, and when it comes to feeding your baby, I mean, that's a really important thing to do, because breast milk is so important for a little one. But if you're not able to breastfeed, or it's difficult, and it's too difficult where you're sacrificing your health and maybe your relationship, or if you have another child, your relationship with the other child, then just be flexible. Maybe you're gonna supplement a little formula at night, and so that you can get some sleep. Maybe you're gonna, combine breastfeed and formula, because even just a little bit of breast milk makes a huge difference. It doesn't have to be 100% breast milk, because every ounce of breast milk is gold, so they're getting all those that support. So
what I had to tell myself when I had my babies, and when I tell my patients, is that, it's okay to be good enough. Like, it doesn't have to be perfect. When we try to get perfection, we get into a lot of trouble. And the other thing is to remember that, yes, this little baby is really important, and they're like the focus of your life, but there are there's more than just your baby to life, right? There's your health, your partner, your family. And that's something we need to remember too as our children grow, that they're not the focus of our entire world.
Right.
It's teamwork. And the other thing I encourage women to do is make sure they have as good of a support system as possible. Mm-hmm. Because this is really hard to do on your own. And I think that's part of the problem, is that we're all alone having babies. You're home by yourself. Mm-hmm. Maybe there's no family around, no one to coach you on how to breastfeed, no one to there's less community. Mm-hmm. That's a problem, and I wonder if that increases these mental health challenges. So joining a mom's group, just being around others to support you and help you through some of your challenges, and knowing that other people are going through it too, I always find that really helpful.
Yeah, we like to call it peer support.
Yes.
Being with your peers who get it, who understand it, who can say, I struggled too with breastfeeding, it wasn't working right, or, I didn't want to take medication, but I did. When I started, eating breakfast, it made a difference.
Right.
Like, there's those type of things. I don't know if you want to speak to a little bit more about different ways to support our total health from more of a natural medicine viewpoint.
Some of it can be really simple, because simple things can make huge impacts. So just by eating 3 meals per day, that you have some protein with each meal. If a lot of women will feel much better doing that, because I have so many women who come in and they're not eating enough.
Yep.
They're not having regular meals. They feel terrible. That really throws your adrenals and your circadian rhythms off. It just wreaks havoc. So a simple thing like that can help. And I try to coach my patients too about some ways to make things easier. Like, you can get some takeout, you can get some pre-made meals from the groceries, or pre-made chicken or something, or some real quick things like a hard-boiled egg. So I do a lot of counseling to help make it simpler. And if you're struggling with certain things, then we will look and see if there's a physical cause, right? Like, if you have low milk supply, you've got to make sure your iron levels are optimal, thyroid's working okay. Those are big ones. And just set realistic expectations too. If a woman has PCOS, it's probably going to be hard to breastfeed.
Can you say what PCOS is?
Sorry, polycystic ovarian syndrome.
I'm thinking about back when I went through my postpartum, and I was starting my medication. My parents were helping me, supporting me, doing everything, and like all of a sudden it would be a time of day where I'm like, the anxiety would just get really bad. And I had a therapist say, I called my therapist and I said, I'm not doing too much. She goes, this time of day, it was like 3 in the afternoon. It was a really difficult time of day for everybody, 3, 4 in the afternoon. She goes, but watch your blood sugar. Did you eat? And so I remember being with my mom and being like, anxiety attack, and she goes, did you eat? And I was like, no, I didn't. And I just realized like how much food can impact us, and because it is hard to have time to eat or make a meal, or my gosh, if you have like a bunch of kids and they all like are so picky,
Yeah, I know
it's really hard, but just to simple, keeping it simple.
Yeah, like
but
a Go
nurturing.
Macro bar, protein bar.
Oh, those are my favorite.
Yeah, again, that's where maybe it's not perfect, right? You're not having this awesome perfect meal, but you're getting enough of what you need.
Yeah, I think that's what I want moms to take home, is like the perfection piece that you talked about. And then there are so many different tools out there that we can bring in to support us and help us be well, and like don't have to do it on your own.
Right.
I mean, you just like, we're not meant to do this on our own either.
I think so. Yeah.
Not at all. It might feel like that, but
that's where it helps to have a team of health professionals, whether it's your therapist or naturopath, is just to run things by, and often someone looking from the outside in can help identify some things that might not be working well, and that also takes out a lot of the questioning, like, should I do this or should I do that, or, you know,
the shoulds.
yeah. You know, it helps to have someone tell you what to do sometimes, and then you just be a good student.
Right.
Yeah.
I would like someone to tell me what to do.
That's really, yeah, and to know, like, this is the exact right thing to do.
Don't have to think. Yeah.
30 minutes.
Okay. So, any questions have come in? Because we just answered everything that's on everybody's mind.
So.
We're so good. Well, I guess, you know, just kind of wrapping it up. Can you tell us a little bit what it would look like if somebody came to see you?
So for a new patient appointment, you would come in, and mostly we do a lot of talking in that first visit, so that I understand what you need help with and what's going on. And then I always have a lot of questions to kind of figure out what might be causing your symptoms, because that's the first goal, is to just see, is there a physical cause of why you're feeling the way you are, you know, whether fatigue or struggling with your mood. It's always very important for me to understand someone's goals as well. So, you know, like, someone might come in and say, I want to stay on my medication, but I just want to support my body in other ways, and we would do that. Others want to work towards getting off their medication. And so as we talk about symptoms and get a good health history, family history, it's a lot of information gathering, then we would talk about ways to start approaching things, like a general plan of action, which we would implement over time, you know, and as we figure out what's causing things, whether it's a hormone imbalance or nutrient deficiency, then we would use different dietary strategies, lifestyle strategies, nutrients and herbs and homeopathics to support the body and improve functioning.
Excellent.
Yeah.
Wonderful.
And can you, for those who are not very familiar with MMHI, can you tell us a little bit more about how your organization supports women in the postpartum period who are struggling with their mental health?
Absolutely. So Mom's Mental Health Initiative, we're a grassroots nonprofit. We launched in March of 2016, and our mission is to help moms, families, birthing people navigate perinatal mood and anxiety disorders. So basically, anxiety, depression, that whole umbrella of mental health conditions in the pregnancy up to roughly 12 months postpartum, left untreated, definitely can go on longer. And we do that by connecting moms to resources. So really pointing them towards treatment, pointing them towards what they need so that they don't fall through the cracks, filling in that gap between something isn't right and I'm getting help. Well, helping them know where to head, which direction. We've got providers that we've screened, we've vetted, we trust to help someone through this perinatal period. We can do warm handoffs, and we're not going to leave you sitting alone. We also do a lot of education on the patient mom perspective. What do these conditions look like on somebody? Not just what they look like in a book. And they can look very different, especially in the perinatal period versus not in the perinatal period. Depression, anxiety, bipolar, all these conditions, OCD. So really helping the community, helping providers understand what it can look like and what someone needs to get better, not just treatment-wise, but emotionally, helping them be able to relate to somebody who's going through it. And then we also do a lot of peer support programming. We have an online peer support group for perinatal women who are struggling. We also try to sponsor and support different clinicians and different mental health leaders in running their own peer support in the perinatal period. There's just not a lot of support out there at a higher level for the perinatal population. Like you could go into intensive outpatient programs, but they're not perinatal specific. There's support groups, but they're not necessarily perinatal specific in the pregnancy and postpartum period. So we really want to foster others to be able to do that and make it easy for moms to access. So the peer support, connecting moms to resources, and then, you know, really helping people understand like this enigma of perinatal mental health conditions, because they are the leading cause of death amongst pregnancy-related women. They are in Wisconsin for sure. Women of color are disproportionately affected. So nationally, it's 2 to 3 times more likely they could die from pregnancy-related condition, but in Wisconsin, it's 5 times. So we're looking
mental
at
health related conditions.
Yeah, I mean, any pregnancy-related condition.
okay.
We just know that the majority of them are mental health related, and that's later in your postpartum period, 6 to 9 months.
Right, like it's normal to kind of feel a little down in those first few weeks or months, but then it never lifts. That's the problem, right?
It can get worse.
Yes.
Yep. So, you know, suicide, overdose. So we really want to educate everyone out there, like, you're not alone, and with the right help, you can feel better, and you deserve to feel better.
Yeah.
You know, it takes a village to not just raise a child, but to support a parent. Yeah. So that's us.
That's wonderful. Yeah.
Yeah. Great.
Wonderful.
Well, thank you. And I suppose if anyone's interested, they can call, email, lots of social media. Same as us, you can email, find us on Instagram, reach out.
Yeah, and if you're interested at all in becoming a patient, you can call the office, and the office staff is really great about answering your questions about what it'd be like to come in and the costs and what kind of conditions we can help with, so you can get a lot of your answers that way.
Wonderful. Thanks so much.
Thank
It was
you.
really good
Really
to
nice
talk.
talking
Yeah.
with